Good morning. On this day in 1634, 150 European settlers sailing on the Ark and the Dove set foot on Maryland soil for the first time at St. Clement's Island in St. Mary's County. So even though we're in a state of emergency, I want to wish everyone a happy Maryland Day as our state celebrates its 386th birthday. 20 days ago, we confirmed the first 3 cases of COVID-19 in Maryland. All 3 were passengers on an Egyptian Nile River cruise. I immediately issued a proclamation declaring a state of emergency. We submitted a supplemental budget which included funding for emergency coronavirus preparedness expenses and emergency legislation allowing us to transfer all necessary resources from the state's rainy day fund. At my direction, the Maryland Department of Health began working with the Maryland Institute for Emergency Medical Services Systems to coordinate surge planning, and we elevated the state response to activation level. 19 days ago, I directed the Maryland Insurance Commissioner to require all state health insurers to waive any cost-sharing co-payments, co-insurance, or deductibles associated with testing for the coronavirus. 16 days ago, our state had 5 confirmed cases of COVID-19. We enacted our emergency legislation into law and convened a coronavirus response team composed of the leading doctors and scientists in the region. We canceled all out-of-state travel for state employees and advised all state agencies to prepare for a period of mandatory telework. 15 days ago, our state had 9 confirmed cases of COVID-19. I convened an emergency meeting of our entire cabinet, met with leaders of the state's long-term care community, and issued recommendations to our state nursing home facilities in an effort to protect older Marylanders. 14 days ago, the World Health Organization declared the coronavirus outbreak to be a global pandemic. Maryland had 9 confirmed cases of COVID-19. We immediately moved toward an all-appointment system at the Motor Vehicle Administration, and the Maryland Health Benefits Exchange established a special enrollment period specifically for the coronavirus. We restricted access to nursing homes and issued guidelines for all state veterans facilities. 13 days ago, we confirmed the first case of community transmission of COVID-19 in Maryland and immediately turned our focus from containment to mitigation. I directed the Maryland Emergency Management Agency to move to its highest activation level and enacted an executive order activating the National Guard. At my direction, all non-essential state employees began a mandatory period of telework. We restricted access to state buildings, including the State House, and issued an executive order prohibiting gatherings or events of more than 250 people. We closed all senior activity centers, closed the cruise ship terminal at the Port of Baltimore. We directed all hospitals to immediately adopt new visitor policies, suspended visits to all Maryland state prisons, and at the direction of Dr. Karen Salmon, State Superintendent of the Maryland State Department of Education, all Maryland public schools closed statewide for 2 weeks. 9 days ago, our state had 37 confirmed cases of COVID-19. I enacted an executive order to shut down all bars and restaurants, movie theaters, and gyms across the state, prohibited any gatherings of more than 50 people, and activated 250 Maryland State Police troopers of the Maryland Field Force to help with enforcement. I enacted an executive order directing the Maryland Department of Health to conduct an assessment to open closed hospitals and to take other measures necessary to immediately increase our capacity by an additional 6,000 beds. We activated the Maryland Medical Reserve Corps and issued an executive order to allow any practitioner who holds a valid out-of-state or expired medical license the ability to practice in our state. We activated 2,200 members of the National Guard and issued executive orders to prohibit utility companies from shutting off service or charging late fees, and to prohibit the eviction of any tenant during the state of emergency. 8 days ago, our state had 57 cases of coronavirus. I issued a proclamation to postpone the April 28th primary election and directed the State Board of Elections to implement a vote-by-mail system for the 7th Congressional District special election. We moved to 100% cashless tolling statewide to reduce person-to-person interactions and dramatically reduce MARC train, local bus, light rail, metro, and other commuter bus services. 7 days ago, it was my sad duty to report the first death in Maryland as a result of the coronavirus pandemic. As chairman of the National Governors Association, I convened and led a call with all of my fellow governors across the country. We agreed to 5 immediate priorities that we requested of the federal government. First, we agreed to push for dedicating at least 50% of the Phase 3 supplemental directly to the states. We second push for increased access, production, and supply of PPE, masks, test kits, ventilators, and other supplies. We push for authorization of Title 32 to give governors maximum flexibility with the use of the National Guard. Fourth, governors agreed to push the federal leaders to provide guidance on how the Defense Production Act could be implemented. Fifth, the governors requested a delay and greater flexibility in both the completion of the 2020 census and the transition to Real ID. 6 days ago, at my direction, the Maryland Department of Transportation began restricting access to the BWI terminal for ticketed passengers and badged airport employees only. We also amended our previous executive order based on new CDC guidelines to prohibit events of more than 10 people in close proximity, and we closed all enclosed shopping malls and entertainment venues. The Board of Regents of the University System of Maryland made the decision to keep students off campus for the remainder of the semester. Through Phase 1 of our hospital surge plan, 900 beds had been made immediately available, and a new floor was activated at Mercy Medical Center in Baltimore City. 2 days ago, we had 288 confirmed cases of COVID-19. I enacted an executive order closing all non-essential businesses in the state, ramped up enforcement actions against crowds and gatherings, and rolled out a $175 million immediate relief package for Maryland workers and small businesses. And while we're thankfully not at the level of infection and death that we're seeing in some other states, we've been taking swift, aggressive, and unprecedented actions in an effort to stop hundreds of thousands of people from becoming infected and to save the lives of thousands of Marylanders. Yet in spite of these aggressive actions, this crisis continues to escalate at a rapid pace, and as I have been repeatedly warning over the past 3 weeks, as of this morning, Maryland now has 423 confirmed cases of COVID-19, an additional 74 cases in the past 24 hours, which is the largest one-day rise to date. We now have positive cases in 22 out of our 24 jurisdictions. Sadly, yesterday, a Prince George's County man in his 60s who suffered from an underlying medical condition became the 4th Marylander to have died as a result of the coronavirus. The first state employee died of COVID-19, a research professor at UMBC who actually lived in New York and is counted as a New York case. 2 midshipmen at the U.S. Naval Academy here in Annapolis, and several members of both the University of Maryland College Park and Anne Arundel Community College communities have also tested positive for the virus. While COVID-19 still appears to be more deadly to older citizens over 60, 217 individuals with the virus in Maryland are between the ages of 20 and 50. The vast majority of people in our state who have tested positive so far are in their 40s. And we have children as young as 10 months old who have the virus here in Maryland. There are now more than 900 cases in the capital region, 55,000 cases in all 50 states across America, and 436,481 cases in 196 countries around the world. And the reality is that this crisis is really just beginning here in our state and across America. And people are looking for certainty, but the truth is we simply don't yet know how bad it's going to get, or how long it's going to last, or how successful these social distancing actions are going to be in flattening the curve. What we do know is that it is not going to be over in a matter of days or even weeks. And as I have been saying over and over again since day one, the number of cases is going to continue to rapidly and dramatically rise. It is critically important that every single person remains vigilant and continues doing their part by staying in place in their homes as much as possible so that we can break the back of this virus. According to the CDC guidance that was issued yesterday, any Marylander or anyone visiting Maryland who has recently spent time in New York or visited the tri-state area must quarantine in place and limit all contact with others for at least 14 days. I have formally submitted a request for a presidential disaster declaration for the state of Maryland to help provide funding for state and local governments, as well as nonprofits, for such important initiatives as disaster unemployment insurance, hazard mitigation, and emergency protective measures. This disaster declaration will be another important step in our aggressive and coordinated response to COVID-19. Later today, I will be chairing another call of the National Governors Association. The nation's governors are working hard to speak with a unified voice and to drive further decisive action from our leaders in Washington. We have another call scheduled for tomorrow with the governors and with the White House, and we will continue to push for greater progress on the priorities that we submitted last week. We still need much more progress on ramping up the production and delivery of PPE, test kits, ventilators, and other necessary equipment. We still need more federal resources directly to the states that are on the front lines of this crisis. Last week, the governors requested that one half of the stimulus package, the third stimulus package, go directly to the states. And I pressed the issue in calls with the Vice President and with the Treasury Secretary and leaders in both houses of Congress. The good news is that the Senate has agreed to some aid to the states, and while it's still not enough, I know that they're negotiating back and forth with the House, and it's encouraging that both parties seem to have reached an agreement. I urge Congress to pass the stimulus package today, and I want to thank our federal partners for taking swift action on this, although we're going to come back again and ask for additional funding for the states and local governments to help with this crisis in the next round of stimulus. We want to thank them for taking swift action on extending the deadline for the 2020 census, which we pressed for, and for acting just this week to extend the deadline for the transition to Real ID, which we requested. We're still awaiting final action on Title 32 for all of the states. They did it for the first 3 states that are having the biggest issues, but all of our citizen soldiers that are stepping up in each of the states need the exact same help so that FEMA and the federal government can help cover the cost of these National Guard's important relief missions. We continue to make rapid progress in our plan to increase hospital capacity here in Maryland in order to meet the demand created by the escalating spread of the virus. Last week, we were successful in making 900 beds immediately available within our existing hospitals by freeing up capacity. As of today, we have now been able to make 2,400 beds available, which is actually weeks ahead of the schedule that we had been shooting for, and it's good news. Yesterday, I toured a site of a field hospital in the Baltimore Convention Center. The National Guard is ready. It's a great partnership between the University of Maryland Medical Center and Johns Hopkins. The Guard, working with a number of our state agencies, we're waiting for FEMA to deliver these beds and the equipment needed, and then we'll be ready to get that off the ground. We're also expanding the capacity of our clinics and hospitals. But besides expanding the physical footprint, we also need to expand and in addition to the stuff that we're looking for help on from the federal government with respect to the supplies needed, we also must expand the manpower that's required to staff these facilities. And so, as I mentioned earlier, I issued an order last week to fast-track the licensing processes for out-of-state healthcare practitioners and those here in our state with expired medical licenses. I also issued an order to provide more authority to credential emergency medical technicians and paramedics to be able to work in our clinics and field hospitals. And we activated the Maryland Medical Reserve Corps, which is a force of 5,000 dedicated to medical and healthcare and other professionals who had volunteered and ready to assist in any public health emergency. And last week we had 700 members of that corps that stepped up and raised their hand, volunteered for service, ready to be activated. Since Friday, more than 2,300 more people have signed up to be a part of this initiative, bringing the total workforce up to more than 7,300 individuals who are willing to assist. These volunteers have signed up from every single jurisdiction in the state, including both medical personnel and people from other professions, including behavioral health specialists, engineers, child care workers, and teachers and construction workers, all willing to help with the crisis. In the spirit of service in Maryland, it's always really at its best when we need people the most, but we still need more help, and so we encourage people to continue to take a look and at how they might be able to help their neighbors and their communities. Today, I'm directing the health department also to immediately institute a program to encourage and to allow medical students and nursing students and people studying to get degrees in medical technician studies from our universities, our colleges, and our community colleges to be able to be a part of this program and to assist and be a part of the effort. To sign up, to try to be a part of this program, you can go to mdresponds.health.maryland.gov. To help older Marylanders get through this crisis, Maryland has just received $4 million in federal funding to help our communities provide at-home meals for older adults, which is important since community centers are closed and some family caregivers are unable to assist older loved ones. Maryland is also the first state in America to provide free telephonic service to check in on older residents, and we're urging Maryland seniors to make use of this service during the COVID-19 state of emergency so that they can receive a check-in call every day at a regularly scheduled time where we'll have someone touch base with them to make sure that they're okay and see if they need any help. To sign up for that, you just call 1-866-50-CHECK. We encourage our seniors to take advantage of that. Last week, we launched the Maryland Unites initiative to highlight ways that Marylanders can volunteer in assisting their neighbors and communities in the days and weeks ahead. And we encourage people that want to help to go to Maryland Unites. Over the next 3 days, the University of Maryland will be partnering, University of Maryland Medical Center will be partnering with the Red Cross. I mentioned last week I spoke with the national president of the Red Cross who said they have a critical need for blood here in Maryland and across the country. We're going to be partnering to hold a blood drive to address the critical shortage that's been caused by this pandemic. So those interested in participating in the blood drive can sign up at redcross.org. Individuals and businesses across Maryland continue to step up to help aid in this massive effort to slow the spread of COVID-19 and to help their neighbors. There are hundreds. I just want to give a shout out to a couple, including Sagamore Spirit Distillery. I mentioned before that many of our small distilleries were working on this, but Sagamore is a pretty big operation. They now have begun the process of making hand sanitizer for Johns Hopkins. The distillery is working on an initial batch of 54,000 liters with the plans to make much more to meet the escalating demand caused by the crisis. Last weekend, Marlin Steel Wire Products, another Baltimore-based manufacturing company, had their workers fulfill a huge rush order to make stainless steel COVID-19 test tube racks. And I just want to thank those two companies and all the other large and small businesses who have stepped up to be a part of this all-hands-on-deck effort. Dr. Karen Salmon, the superintendent of the Maryland State Department of Education, has some major announcements to make regarding the Maryland Public Schools and child care facilities across the state. But before I turn the podium over to her, I just want to take a moment to speak directly to Maryland's parents, teachers, and students. I know how incredibly difficult and confusing this last couple of weeks has been for you. Teachers want to know when they'll be able to get back to their lessons and when they'll see their students again. Parents are concerned about how their kids will be able to continue to learn, how they're going to be able to handle child care, and the students want to know when they'll be able to get back to their normal lives and when they can see their friends and their classmates again. There's a lot of confusion and fear and anxiety and uncertainty right now. It's frustrating and challenging. I just want all of you to know that there's nothing more important to us than your health and well-being and your education. And I want you to know that there are a tremendous group of people, your superintendents and people in your local school systems and the State Board of Education, a whole lot of people working across the state around the clock to try to come up with good answers to these questions. And I want to thank them for their efforts. We're all in this together, and we will get that through this together. So thank you, and with that, I'll turn it over to